As the first case of the Omicron coronavirus variant was reported in the United States, Dr. Anthony Fauci, the nation's top infectious disease expert, cast the detention as a reason for Americans to get vaccinated or boosted and said that public health recommendations had not changed in the presence of the fast-spreading variant. He said he was not so sure that new testing requirement administration officials are currently weighing for international travelers will have helped catch the case sooner because the patient took a test immediately after beginning to experience what described as mild symptoms, and he said it was possible that in the future the federal government could change the definition of fully vaccinated to require international travelers to have received booster shots before entering the United States.
I think what's happening now is another example of why it's important for people to get vaccinated who've not been vaccinated, but also boosting. Boosting is really very important because the data that we get on boosting, if you look at the level, for example, of an antibody, a neutralizing antibody, peak following the second dose of a 2-dose mRNA, it's like at this level. If you look at the peak following the third shot boost, it goes way up here. And people ask, why is that important? Because our experience with variants, such as the Delta variant, is that even though the vaccine isn't specifically targeted to the Delta variant, when you get a high enough level of an immune response, you get spillover protection even against a variant that the vaccine wasn't specifically directed at. And that's the reason why we feel, even though we don't have a lot of data on it, there's every reason to believe that that kind of increase that you get with the boost would be helpful, at least in preventing severe disease of a variant like Omicron.
Here.
Dr. Fauci, as you know, a lot of Americans right now are shopping for the best sort of booster or whatever they can get. And given the fact that manufacturers and scientists are racing to learn more about this variant and then to modify a vaccine that will more directly combat it right now, first, for those who already received their boost, how long would it be for them before conceivably they could have a new modified booster that will more directly target this? And is there any reason those individuals should wait, given the White House has said it will be a couple of months perhaps before we have a more modified vaccine that more directly targets it?
Great question, because we get asked it a lot and it's a relevant question. So right now, I would not be waiting. People say, well, if we're going to have a booster-specific vaccine, should we wait? If you are eligible, namely 6 months with a double mRNA dose or 2 months with the J&J, get boosted now. We may not need a variant-specific boost. We're preparing for the possibility that we need a variant-specific boost. And that's what the companies are doing. The administration has been in contact with the pharmaceutical companies to go ahead and take the steps in case we need it. But the mistake people would make is to say, let me wait and see if we get one. If you're eligible for boosting, get boosted right now.
Sabrina.
Thank you, Dr. Fauci. Follow up to Tyler's question, because there is screening in place for international travel, but we've seen how quickly variants can spread once they reach our shores. Does the science not suggest that there should at a minimum be a testing requirement for domestic air travel? And if not, why not?
Well, again, these kinds of things we always talk about and consider, but right now, I'm not so sure we need a testing for an air travel in this country. I always get back to the fact is that people should wind up getting vaccinated and boosted if they're eligible for a boost. I keep coming back to that because that's really the solution to this problem.
Jenny.
Two quick ones. Moderna executives have said in the past couple of days that this variant appears threatening and may demand new vaccines. What do you make of those remarks that seem a lot more alarmist than the administration's view or other vaccine makers?
Well, I know that we don't have enough information right now. As you know, and we've said this, that the profile of the molecular profile of the kinds of mutations that you see would suggest, A, that it might be more transmissible and that it might elude some of the protection of vaccines. But we don't know that now. We don't know what the constellation of mutations are actually going to be. We have to be prepared that there's going to be a diminution in protection, which is the reason why I keep getting back over and over again and say why it's so important to get boosted. But I think any declaration of what will or will not happen with this variant, it is too early to say. And I think we need to be careful because I know you're going to be reading a lot of tweets and a lot of comments about this. We're really very early in the process.
Say say though this proves more transmissible but less virulent than Delta, would there be any public health benefit to furthering its spread by lifting travel restrictions, for example, so it can outcompete the Delta variant?
You're talking about something really dangerous. You're talking about let a lot of people get infected to see if, in fact, you could protect them. That's something that I think almost all infectious disease people with any knowledge about infectious disease would not say that's a good idea.
Dr. Fauci, we are firmly in the holiday season, and a lot of Americans are wondering whether it's safe, even if they've been vaccinated, to go to a cocktail party without a mask, with a glass of eggnog in their hand. What's your advice to them?
Well, the advice is what I follow myself and what I tell people to do, is that get vaccinated. I'm going to get to your question. I'm not eluding it. Get vaccinated, number one. If you're eligible for a boost, get boosted. And in a situation with the holiday season, indoor type settings with family that you know is vaccinated, people that you know, you could feel safe with not wearing a mask and having a dinner, having a reception. But when you are in a public congregate setting in which you do not know the status of the vaccination of the people involved, it is very prudent to wear a mask. And that's what I do.
Events. Based on your medical advice, is that something that you would have recommended if he had tested positive?
Well, I would recommend to anyone, whether it's the president or any of my patients or any of the people that I deal with, that if you test positive, you should be prudent and quarantine yourself.
Christian.
Dr. Fauci.
Christian.
Dr. Fauci, with all due respect, there's zero case of COVID, of Omicron case in Zimbabwe, in Namibia, in Lesotho, in Mozambique. What justify imposing a travel ban on countries that have zero case of the Omicron variant?
You know, that's a very good question, an important question, and we did struggle with that, but we wanted to see if we could bide time temporarily. So I do hope that this gets sorted out and lifted before it has any significant impact on your country.
Go ahead. I think we have to keep going so we can have people.
Thank you, Dr. Fauci.
Go ahead.
Last week, the governor of New York signed an executive order to postpone elective hospital surgeries to prepare for the Omicron variant. I know that you and your team are being proactive as we try to learn more about this, but do you believe that some states might be going too far too quickly before we know too much?
You know, I really don't want to comment on situation in individual states because there are so many factors from state to state that are different. I don't think it would be appropriate for me to comment whether a state should or should not postpone elective surgeries.
And then the president said that we will defeat this variant of the coronavirus, not with lockdowns or shutdowns, but based off of, the tools that we have now. Is there anything that we are, taking into this new variant experience based off of some of the adverse effects of some of those lockdowns? I mean, we just passed, I think, 100,000 overdose deaths for the first time ever.
Yeah, I mean, first of all, we always discuss things that we might do to better our preparation, better our response. That's something we discuss every single day. But right now, what I've always said, and I'll continue to say, let's utilize and implement the tools that we have, because if we had done that, if we had the overwhelming majority of people in this country vaccinated and those who needed to be boosted, our vulnerability would be much less than it is right now.
Brian, last one, then we got to let him go.
Dr. Fauci, what do you see as an end game? In the 1918 flu pandemic, it eventually evolved till it was less lethal. But there are those who are saying that we're never going to get that far with this virus because we need more people vaccinated. What do you see as the end game?
I mean, the end game, which we hope and I think will occur, is that as we get more people vaccinated, not only in this country, but globally, we will see a situation where viruses will not have the opportunity. What they have right now is to essentially freely distribute and freely circulate in society, both domestic society and global society. The more protection you get with vaccines, the less likelihood a virus has to do that, the less likelihood a virus has to mutate, the less likely you're going to get a variant. So one of the things that we need to do about our long end game is to do the things we've been saying every single day, not only for ourselves, but internationally. And we have done a lot and will continue to do a lot to get low and middle income countries vaccinated.
Think it'll evolve and be something less lethal?
Oh, absolutely. I mean, there's no doubt that this will end. I promise you that. This will end.
Thank you, Dr. Fauci. Sir, we